Black women are half as likely to go seek help or accept help as their counterparts. What reasons do you feel that that occurs, and how can we continue to advocate to dispel some of the stigma behind seeking help for your mental health?
So there's three factors
Okay.
I would say factor in.
Mhm.
One of them, it is just a fact. Like that's a statistic that's based on actual help seeking behaviors as evidenced by seeking formal therapy or
Mhm.
seeking treatment.
Mhm.
Some forms of depression do not require formal treatment. Okay, so if you do not have clinical depression, you do not necessarily you don't have medical necessity for treatment.
Mhm.
How do we know somebody has clinical depression? You probably don't. So there's the problem right there. Is that clinical depression looks like sadness sometimes, and it looks like plain depression, which I call it vanilla depression, where you're gonna be fine. You just need to
Mhm.
live it. But how do you know? You can't really tell unless you go to see somebody
Mhm.
and they do a full battery of tests. They do a full psychosocial. They find out if there's any medical conditions that could be mimicking. I mean, there's you have to figure everything out. Easy example is diabetes, lupus, MS. All of those
Mhm.
mimic depression, and specifically with MS, there's some medications for the MS that cause the brain to experience an actual clinical episode of depression. Right. So whether or not there's it's actually factual that these women are experiencing clinical depression is questionable.
Mhm.
And two, there are epigenetic factors that are, to me, conjoined twins,
Mhm.
meaning helping and hurting.
Mhm.
All right. One of them is that I haven't looked at any recent studies. I'll make myself a note here to see if there's maybe some out there. But there are studies that show the inheritance of experience. So in epigenetic studies, we see, for example, Holocaust survivors, children's children experiencing traumatic symptoms as if they've actually been through the Holocaust themselves. They did not. And it seems to be inherited by the father's sperm. So your grandfather's
Mhm.
experience, you're inheriting through your DNA.
Right.
And there was a study on this group of men who survived a famine. And those survivors of the famine then reproduced offspring who had DNA changes to help them survive a famine. But they didn't experience a famine though.
Mhm.
So
Mhm.
yeah, so there's some social inheritance of experience, right?
Mhm.
Well, what group of black women you know on this here earth, on this here earth anywhere, who were given the luxury of having a day off when they were experiencing clinical depression? That number would be right there at zero. Right?
It's like, well,
So,
unless they're on some far island that I'm not aware of.
so I sometimes talk about this in therapy that you are the strongest of your ancestors because
Mhm.
you've inherited the strength and weakness. And you, so even for me this year, this is my year to become as consciously aware as I can of just my mother. Like I'll pick my grandmother maybe another year or my great, but just this year is of my mother, the things that I inherited that were strengths and weaknesses. So if
Mm.
we talk about depression, we're really talking about neurogenesis, the brain cell reproduction, and more specifically of baby neurons. So one of the factors is the epigenetics. What did this woman inherit? Well, she's a black woman. She inherited from at least two generations back,
Mhm.
whatever that generation was exposed to. Right. You see what I'm going? Right. She inherited their strengths and weaknesses.
Mhm. And considering the history of Black America, we all know what we experienced.
Yeah. So that would be like, well, why would she engage in help seeking behavior? Because she probably you don't need to. She might not need to
Right.
until she reaches a certain threshold of clinical depression to where there is no other option except to engage in help seeking behavior
Mhm.
because we are living in this world
Mhm.
versus the world our great great grandparents lived in, where you would survive a day versus live a day, right?
Mhm. Mhm.
Here, you got to live a day. You got to actually get in your car, drive. You
Mhm.
got to navigate the world in a different way. And you're actually using different parts of your brain than your great grandparents had to use. And they had some other things that help them that don't help you. One of them being farm work or agricultural work or working outside. Those things
Mhm.
actually help your brain to be more cushioned, which is no big jump to see where, well, what happens when you work out outside versus inside, where your brain responds more quickly. We can measure those things. And some of it is just the way the body's made up.
Mhm.
So, factor, epigenetics. Another one that I personally see, like in my everyday practice, has to do with accessibility. I didn't see this until I was doing this part of the work, but in the same company, you could have people who are in upper level management having access to different kinds of benefits than people in lower positions. So
Hmm.
you have to use the easy example, a person who is in mid level management, they have access to benefits, but not access to time off to use those benefits.
Right.
Okay. Then we go up the food chain a little bit further, and the person has more flexibility. They have both their benefits and the flexibility to use those benefits. And this is actually what I physically see is that
Mhm.
if somebody is in the C suites, they can just decide I'm not coming in until 12.
Right.
Who's gonna check me, boo? Like, right. So that's one of the things I see. And then I want you to think about the corporate world we know of as far as the statistics go. How many how many of the same people you just described, how many of them are in those C suites? Right.
Yeah.
So within the world of work, we
Mhm.
still have an overload of people who are down versus up. And
Mhm.
so my experience as a practitioner is the further down the person is on that food chain, even if they technically have access to the same benefits, they do not have access to flexibility.
Mhm.
Right. And if they are a wage earner, not salaried, even when they use those benefits, they have to their detriment an economic hardship because they now have time off the check immediately. Right. So I'm saying, some of it is them saying, here are the statistics. And I'm like, well, okay, here's the lived experience of it. When I
Mhm.
see people, and I see everybody, I tell everybody that I see everybody, all walks of life, all walks of life. I see the people who are developers and the people who are homeless. The people who are developers can come see me when they feel like it.
Mhm.
First of all, they may actually pay for a session, but they have some way of reimbursing themselves for the session, costing it out on their. I mean, they're not quite experiencing the financial cost of the session the same as somebody else.
Right.
So that's one. The other third factor is just the human unfortunate factor. Most mood disorders sneak up on you without announcing themselves from miles away. So you find yourself in trouble
Mhm.
versus if you had the flu
You
or
feel
something
the
like that,
symptoms. Yeah.
you have symptoms, and the first you're like, "Oh my God, I hope I don't have flu," and then you start thinking back, "Who was that around here?" And then you're like, "Let me
Mhm.
see." You start checking those symptoms, and you're trying to take care of them, but you're already in your mind like, "I think this is the flu."
Right. Right.
You kind of prepare your world for, I think I got the flu. Let me just, you start adjusting. Well,
Right.
with mood disorders, again, unless you are going for, not recommend an annual checkup for anybody. Go get an annual checkup for here are a couple of reasons, just as an aside. That practitioner is kind of build history with you and
Right.
can more quickly notice that this is not normal for you. If you're going to somebody new, they don't have history, they don't
Right.
know, and catching somebody up on your whole life history.
And it's 15, 20 minutes is not like
It's not good. Right, right, right. So you really need history. And then two, even with history, we have to allow you to connect with us. We got to connect with you. And so the course of figuring out what's wrong can
Mhm.
easily take 2 months to be quite accurate.
Mhm.
It's just as somebody's in pain does not mean they have a mood disorder.
Mhm.
It may mean that you don't need to work at that job no more. Or maybe the relationship really is over. Or your bad
Yeah.
kids, they not responding to gentle parenting. I mean, I'm just saying. It could be environmental stressors.
Right.
And right, or acute stress. And acute stress only responds to problem solving. So you come into therapy every week and it's steadily getting worse. It's not that therapy wasn't working, it's that that had to be solved for you to feel
Like,
better. And until you solve it, you're just going to feel worse and worse and worse
it's like ruminate on the same thing over and over again. It's
over
like
and
no
over.
matter how
Right.
much you throw at it, it's still going to the culprit is
Yes.
not
Right.
rectified at that point.
Right. So that's the third factor. That's the third factor. That's my experience with why that might. Well, that is true. What you said is true. It's just that the picture behind it on why it's true. Those are my experiences.